Hi, my name is Karis and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Awesome. Feel free to ask me any questions you might have.
Thank you so much. I look forward to learning a lot. So, you're taking care of the patient in room 600. Do you have time to give me a report?
Sure. I'll give it to you in our normal fashion of SBAR, which is Situation, Background, Assessment, and Recommendation. The patient in room 600, his name is Richard Kind. He is a 67-year-old African-American male. He has no allergies. He's awake and alert and oriented times 3. His speech is clear, his posture is upright, and his gait is steady. His chief complaint for coming into the hospital this time was a non-healing wound on the right heel. He noticed this progression about 3 weeks ago. He noticed he was admitted on Tuesday for high levels of blood glucose readings over 300 within the past 5 days. He's a type 1 diabetic, approximately for about 20 years. He's checked his last A1C 3 months ago and it was recorded at 5.2. So as you know, that means that he's compliant with his insulin. His family history is his father died at 53 of an MI and his mother died of lung cancer at 78. His assessments that I found where his temperature was 98.4, respirations were 18, pulse of 80, regular rhythm of S1 and S2 with no gallops. It is important. Systolic blood pressure of 145, diastolic of 72, O2 saturations of 95 en room air. He weighs about 171 pounds, that is. His height is 5'11". His skin is dry and intact except for the stage 2 ulcer on his right heel, which is 55 centimeters by 5.5 centimeters by 2.5 centimeters at the largest diameter, and 3 centimeters deep, extending into the dermis, but no tunneling was noted, and the base is pink. So, and a little bit of moderate serous sanguis exudate was noted. The recommendation by the doctor was to admit to inpatient medical unit for glucose control, diabetic teaching, pain management, and wound evaluation and care. We have a consult in to a wound care nurse, as well as a dressing change, a sterile dressing change tonight, and we will collaborate with the wound care nurse and team regarding the best way to care for that wound.
Great. Thank you so much for giving me a report. Do you mind if I ask you a few questions regarding the medication administration and then watch you demonstrate giving the medication in the patient's room?
Not at all. This patient is scheduled for a regular insulin dose. It's due soon. He gets it 4 times a day with meals.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
Well, as you know, he's a type 1 diabetic, so the pancreas makes little or no insulin due to the autoimmune problem that he may have. Insulin is a primary use to treat patients with type 1 or type 2 diabetes to achieve appropriate glycemic control.
When should you question administering this medication? Does it have a therapeutic serum level? And what vital signs must be monitored? And also the physiological parameters that you would monitor before giving the medication?
Well, the type 1 insulin, this type of insulin is it's long acting. It's short acting. And should be administered at the same time of day with meals, usually about 4 times a day. The therapeutic serum level is 250 milligrams per deciliter. The nurse needs to watch for signs and symptoms of hypoglycemia. That means changes of mental status, tachycardia, syncope or weakness, or perhaps even the opposite effect of hyperglycemia with drowsiness, rapid deep breath, and again, changes in mental status are the most important.
Okay. What interventions would you teach the client to ensure that the medication is administered safely at the hospital, but also safely at home?
In the hospital setting, we're going to do similar to what the patient typically does at home. We want to have him feel like he's in the most comfortable setting. So we're going to give him an injection sub-Q, in his preferred site, asking him when and where the last injection was. And it should be typically around the umbilicus, 2 inches or out. And so at home, we want to make sure that he's knowledgeable about the proper equipment to use, meaning syringes or cartridge pens, alcohol swabs, the storage of his insulin, places to discard his syringes. It's important to discuss the selection of rotation of sites, and lastly, to be aware of the open, unused insulin vials should be discarded after 1 month.
Wonderful. Also, what side effects and potential adverse reactions might happen from taking this medication?
Well, as you know, the endocrine system has side effects that would produce hypoglycemia, and on the systemic level, you want to be aware to watch out for things like urethemia, swelling of the integumentary system, things of that nature. You always want to watch respiration rates. You want to check the site afterwards to make sure that it's not red and irritated.
Okay. How would you know that the medication was effective?
You would know the medication was effective because his glucose level 30 minutes after the meal were in the appropriate levels. Is there any more questions that you have before I administer the medication?
No, thank you so much for answering all my questions.
Sure, not a problem at all. It's important to know your patient to keep things safe and go smoothly.
Okay.
Blah, blah, blah.